There are many other issues that can lead somebody to become suicidal. Apart from the medical condition, apart from the psychiatric conditions that I've mentioned, depression, maybe psychosis, we can talk about post-traumatic stress disorder, we can talk about chronic loss and grief. There are also medical conditions that is important for us to be aware of. And what maybe would surprise you, you may think HIV, yes, sometimes leads to mental disorder. You might also think like maybe cancer and all diseases maybe in the later stage. But maybe that which would interest you at this moment, and if you can review literature, you may find that there is a correlation between pneumonia, and pneumonia affects the lungs or the breathing system, and mental disorders. And how would that happen? Because if your lungs are perforated, if your lungs are weak, it means most of the times you lack enough oxygen because your lungs are not in that functioning ability to pump enough air. And because the more air is pumped in, the more oxygen can be circulated in the whole system, and especially in your brain. And so if somebody has any viral infection around their chest, you're bound to feel very tired, you're about to feel very disinterested, and worse, if it is chronic pneumonia, it might slowly affect the brain because oxygen is not getting there in good measure or quality or quantity. And so you might find someone with pneumonia having delirium, and they are out of sync, and they can start talking about things that are not existent in this world. You may also find that they are confused, and because their cognitive abilities are highly challenged, they might start losing the memory. And so if it's the case of a student, they might even start wondering, why am I not understanding? Why am I not getting it? And so it's very important to know that whenever people are sick, don't assume they are going to function the same way mentally. And that is why every human being, including the student, should disclose any medical conditions, whether it is at primary level, secondary level, or even at the university level. Why? So that proper, appropriate, responsive medical care can be given to this student. Even for individuals in the workplace, you might be given a lot of assignment to do and responsibilities, and maybe you have a medical condition that you never ever disclosed the human resource director. And so one day they might find you have collapsed, or you have given up and taken your own lives because it's too much. How I pray for an open system, an open mouth, but a very open ear. So anyone opening their mouth to share their problems, let them be weighted by an open ear. And an open ear, by this I mean, you are not judgmental. First and foremost, listen. And the next thing, be open to all options to help this person. And I like to talk to all people that have ever lost their loved one by suicide. You will basically go back and see they were all the telltale signs. Some were a bit maybe out of sync because maybe somebody started drinking too much or abusing whatever substance they were abusing, or somebody became very I don't care, very irritable, and very vicious, very violent, or they start taking risks about their lives without caring, if it is having multiple sexual partners, driving recklessly or riding recklessly, or even using their money recklessly. It's like they don't have a tomorrow. There are others who will typically withdraw, and especially their last moments, they will withdraw. But if you watch and reflect very carefully, you realize some of the signs and symptoms I have mentioned earlier, they were very visible. But when they start withdrawing, it's like they have started saying goodbye to this world. Just like people who are very, very sick in hospital. When somebody starts sensing, I can't make it, they don't even want very many visits in hospital. They are fatigued, they are tired. Even those ones that die by suicide, by the time they are doing that, they are totally tired. The only difference between them and the ones in hospital is that the ones in hospital, there could be a very, very genuine reasons why they have reached that end of life stage, the red stage. There could be a reason. Maybe it's a chronic illness that has reached its end, like cancer, like HIV and AIDS, and many other chronic illnesses. Maybe it is organ failure, and many other medical conditions that take us there. Maybe it's age, because there are those who age maybe over 100 years, and their organs are very, very dysfunctional. They are very slow, and they feel like a burden. But for you, young one, a young one in primary school, a young one in high school, a young one at the university, a young one who has just started working, and even a parent, even if you lack money, because most of the parents right now are crying, we don't have enough money. Globally, there is an economic crisis. But for Africans, it's always worse for us. Because maybe when it's happening, in other words, when you're talking about economic crisis, they have the basic needs. But for us, it's when we don't have those basic needs, it's when you know things are pretty bad. When we lack food, we lack clothing, education, medical care, and shelter. But out there, when you cannot do your own shelter privately, the government has safe nets for people who cannot afford socioeconomic needs. However, there is still a way out. If you want to help someone who is about to take their own lives, one, show them you know, and directly ask them, are you planning on taking your own life? If they say yes, ask them, how do you want to do it? Do you have a clear plan? When do you think of doing it? Because they talk. Oh my, they talk. Because where they are, they don't care about living. And so they don't care even about talking. The only thing they do is to look at that particular moment when there is no one and they can do it. And that is where now we miss the point. And that is where I say it is okay to even take this person to a doctor. It is okay even to report that they are planning on taking their own lives. It is okay. And for the police station, what I pray and the police officers is that do not harass them. But if it were possible for people who may know better, the first place to take them is to a counselor or a psychologist. And if the worst comes to the worst, a psychiatrist. Why? Because if that thought stopping is not happening, it's racing and racing and racing. There is what the psychiatrist would do, and that is the mental health doctors. They will actually give medication that can help just relax that mind, because the thoughts race and race and race. And that is why those people become all of a sudden very hyper. They are unstoppable. And even when they are so quiet, the mind is unstoppable. They are having the plan, I must do it, I must do it. And worse, if these people have a condition that we call obsessive compulsive disorder, it's like they are obsessed by this thought. And that is why some people say they were possessed by an evil spirit. An obsession is like it's taken a hold of you, a center stage in you. And compulsive, it is not relenting. It's pushing and pushing and pushing. And you start thinking it's like there's another push, there's another force. And that is why some of them will say, I was driven by an evil force to do what I did. Somebody came and told me that I should actually die. There was a voice telling me, die, die, die. Because at that time, They're not living in the present moment. You can always ask, especially those who agree with you, especially in counseling, that now that we have started talking, let me commit that I will not think of taking my own life. And you can give them timelines. When they commit, those notes are very critical. File them. Even the suicide notes that they write, please file them. Why? Because you might find somebody dead, and other people might be maybe incriminated in the same, yet the person died by suicide. And that is why you find the criminal investigation department, the officers will always ask, did they leave an evidence? Is there an evidence that they left here? Was there a note trying to find out what was the cause? Because it's always good to know the cause. Because people will keep asking, even after they have buried their loved ones, what made them take their own lives? It's good to look even for verbal communication they had, any posting they ever did. So when they do that commitment plan, follow it, and if possible, every day. The other thing is create what we call functional dependency. There's nothing wrong with having them depend on you for a while, because all they want is to ventilate what is really puffed up within them. And maybe they have found comfort in you. They have found compassion in you. They will tell you everything. They will just ventilate, vent out to you. Kindly, if you have that space, just listen. Even if it doesn't make a lot of sense, just listen, because it will ease the mind as they share with you. You can ask those who don't like to share verbally to write, especially what disturbs them most. And if possible, create a safety partner, somebody that can always work with them. If it is a school environment, the student who is their friend, or the peer counselors, or those students that you can say either your cube mates, your desk mates. So when that person wakes up, goes anywhere, they are followed. It is important for schools to know that, because you know how traumatic it is for students, especially to take their own lives within the school environment. Very traumatic for teachers, for all the workers, and even for the rest of the students. I'm not saying it's any better when it happens at home, but even at home, even in hospitals, if the nurses, the doctors are able to read those signs and symptoms of suicide, they make sure that there is always somebody by the side. Even in prisons, even in police stations, because at that particular moment they're having the push. They only need somebody to disorient them a little bit, or something to disorient them a little bit. And that is why for counseling, it becomes very, very paramount. And if somebody is not hearing me now, COVID-19 pandemic never left us the way we were before. We are so fractured mentally. And I believe everybody who has been present during COVID-19 pandemic, even if you have money, you have moments that are very low, because the environment, the globe, the world is full of heaviness that was brought by COVID-19. The fear of death was so real. The sadness in the world was so real. And we cannot say, we just let it go. Why? Because like in my country right now, there's an upsurge of COVID-19 pandemic cases. They are rising. And so probably when you thought you had forgotten, you said bye-bye to COVID-19 pandemic, deaths, and all the other devastating impact, here it comes back. And so we cannot assume we are the same people that were before COVID-19 pandemic hit our nation, or even your nation, or wherever you are. And this impact negatively, it has been seen in all institutions: family, church, mosque, temples, workplace, and even in schools or learning institutions, and generally in the society. And so continuing assuming that we wait until something happens for us to react is a worrying trend for me, is a worrying position for me. This is the time we need to do more preventive care than curative care. And this is a time we need more counselors than ever before. We need more psychologists everywhere than ever before. Those that volunteer, well and good. Those that are paid, well and good. And companies that care so much about their employees and about their significant others ensure that insurance companies are also taking clients for psychological wellness, because that employee who is not psychologically fit will not perform in your workplace, will not give you what you're looking for. That teacher that has burnout because of the change of the curriculum, squashed semesters and trimesters and terms, will not be good enough for that student. And so everybody needs a touch of psychological wellness. And so it's also good to remind the person who wants to take their own lives that there's always the positive side of life. Create some light moments with them where you can have laughter, where you can go out to a place that is relaxing, especially those who can afford. Those who cannot afford, find out from this person what they like doing, what interests them, what makes them happy, because they are those things that they are passionate about in life. Because if they engage in such, the mood changes. The dopamine, the hormones that are good for motivation, concentration, and feel good hormones, they rise. And the cortisol and adrenaline that is making them restless goes down. And so the things that people do thinking they are very simplistic, including prayer, if they love to pray, singing, if they love to sing, dancing, if they love to dance, knitting, sewing, of course, maybe plaiting hair, maybe playing football, swimming. That is why all of us, it worries me when I find somebody saying, I really don't have a hobby. I don't have a passionate interest. Because it's always good for us to know what makes me tick. Like now, doing what I'm doing right now makes me feel full of life. And so I will do it again and again. It's not just posting. I know it helps somebody. If you go to my YouTube channel, Dr. Susan Gitau, you get help. If you want to go to my Facebook pages, you get those tips. If you go to my TikTok, you get the tips. But that also makes me feel good. And that is why I'm saying with CBC, we shall be able to pick our children. We will be able to pick our students, what they do best, because it thrills them. It makes them feel happy. And for our learners, when they have reached their end for the teachers, it doesn't harm. With the kind of pressure that is here in learning institutions at the moment, not all students have similar threshold or resistance to crisis, resistance to adverse stress impact. And so those ones that are weak because of one reason or the other, it is okay to allow them to just go home for a breather and then come back. The teachers make learning easy. When you get into that classroom, a very simple physiological exercise like the breathing in and the breathing out, and like to make it very simple as this. And then hold so that they can be knowing how to hold things when it's very tough, and then release. Release for wholeness. And they can breathe again. Through the nose, and hold, hold, and hold, and out, and out, and out, and out. Those who may not be so comfortable with their eyes closed, they can open them and take a deep breath. Breathe in, 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 hold, 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 out, 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 out. I feel calm. It's a very simple physiological biofeedback exercise. It may look silly and simple, but it's very powerful. And for Christians where I belong, when you hear of the Holy Spirit speaks to people when they are quiet and peaceful, like when I was taking that deep breath and out. And so even if things are very bad, in that still moment and relaxed state with the breath of life, then the Holy Spirit will have space to speak to you. For those who believe in mindfulness and mindful self-compassion, and I still do, because I find the practice very, very helpful and sinking with my faith, I know it has worked wonders in my own life. I just completed a 9-month online self-compassion in psychotherapy with Mindful for Self-Compassion sponsorship USA. And I can tell you, I have been applying this with my clients. And the most amazing thing is they are taking a lesser time in therapy, spending less in therapy, because therapy can be very expensive, simply because I am training them to use the very resource all of us have been given by God, by nature, a gift from the universe without discrimination. And the only time this gift diminishes is when we have maybe any viral bronchitis infections that reduce the oxygen levels in our lungs or destroys the lung capacity. But even then, you can still take the slow and deep breaths at your own level and capacity. What's the magic behind that deep breath? The minute I breathe in, I am pouring in air and oxygen in it. The minute I hold, I'm giving it time to fill up with my lungs. The minute I release, I'm having it spread so fast within my system, and you can feel it inside your head and definitely your brain. And you feel some calmness, some peace that we all require, even when things are very tough. And so if there's anything I can sell to people to do technically and rhythmically and strategically, is that breath of life. And when things are totally bad, it's always good to ask yourself, do I have to hate myself this much to a point of thinking, taking my own life? Am I that bad? Am I that useless? Am I that hard that when I die, I want to leave people crying? Am I that stupid, thinking that there'll be so many people around my funeral and I'll not be there to see them? No. And so I can still learn to accept myself with my own mistakes, my own failures, my own limitations. And I can still accept me just the way I am, even if I have been called a failure, even if I have been called a disgrace, whatever labels that have been put on me or have put on me, I can still treat myself with kindness. And I can remind myself there is someone else in this world who is feeling suicidal like me. There is someone else in this world who has given up. So it's common humanity to suffer. And if no one comes to my rescue, I want to be my first hero or heroine to rescue me. And amazingly, you will see how resourceful and powerful you are. And maybe in our next conversation, we can look at how can a family bring up a child in a functional way, emotionally, socially, psychologically. How can a school system, if the home environment missed this, if the family, the parents missed this, how can the teacher bring out a holistic citizen? How can the teacher take care of him or herself so that you can be a safe object for that student? What about lecturers? Are we biting a little bit too much? Even when the pay may not be good, the work environment may not be good. Do you know that students, when they come out of your university, they will have your name on their tag because you taught them? Or do you want to be remembered as a lecturer that did the last signature, knowingly or unknowingly, to send off a student to take their own lives? And I like to end by saying, the best people that leave legacies in this world are the people that live not for themselves, but for others. And better still, they live first for themselves. And once they get it all put together, they start living for others. Are you going to join me by sharing this video with all due respect and saying that we want to save a life? No more death by suicide, because you and I are saying no to suicide and yes to life. Thank you, Dr. Susan Gitau. Like, share this video to make a difference and save a life. Asante sana. Thank you very much. God bless. I would like you to subscribe to my YouTube channel, Dr. Susan Gitau, where you will access mental health tips every week, every month, every year. Thank you.